You're listening to Shrink Wrap Faith. I'm your host, Dr. Paul Donato, and I'd love to introduce our guest, Dr. Patricia Vance, a clinical psychologist with 30-plus years of experience and a leader in trauma-based treatment. Patty, you're back.
I'm back.
Okay. This is episode 2 of our ongoing podcast, and we're going to look at a topic that I think is pervasive for our times, and that is narcissism.
Yes.
Okay, so it's out there. And so first, let me ask you a question. This is a confusing topic because
Yes,
we
it
have
is.
narcissism, which is a generally understood characteristic for many, many, many people. And then
Many
we have
people.
narcissistic personality disorder, which is a very different animal.
Well,
I mean, it's
Yes.
distinct.
yes.
So I'm going to ask you, do you think a lot of professionals in general, do you think they have a clear distinction in their mind about what is narcissism versus the disorder?
Absolutely not.
Okay.
Absolutely not. I mean, no, they don't.
They don't. Okay. We can leave it at that. Well,
Let's leave it at that.
The reason why I brought that question up, I just wanted to let our audience know that this is like threading a needle. This is not an easy thing to do.
It's also important, I think, to recognize that only 2 to 3% of the total population has this disorder. It's a very small portion of people, but, it feels like half the world is narcissistic.
Yes. Now, given the fact that there is so much conversation about narcissism, as there might be about another topic I hope to touch on with you, trauma, is this a good thing or bad thing that it's on everyone's lips when they speak about relationships or events in their life?
It's both, I think. I think it's both. On the one hand, it's good that people have more awareness and are more willing to talk about mental health issues, personality issues. I think people in general are more open to the idea of mental health as a common concern, a common issue. And so the fact that people speak about it, I think that's good. On the other hand, such easy labeling of traits that we may not like all that much maybe isn't such a good thing. I mean, what's the difference between somebody with narcissistic traits and somebody who's just a jerk?
Nothing.
Exactly.
Right. So that makes it really easy. Okay. Where did this whole idea of narcissism? I don't think it's a new idea. I think it goes back a century or more to the Greeks.
To the Greeks. Multiple centuries ago. Yeah.
Okay.
I mean, the myth, the fable of Narcissus, right?
Mm-hmm.
Okay. So why don't you tell the audience about Narcissus?
You're asking me. Okay.
Yeah.
So
role reversal here. Sure.
All right, sure. Okay. So Narcissus was a figure in Greek mythology, and he was very beautiful. And I believe he lost his sister to an untimely death. But he was
And so he was lonely.
He was lonely, right?
Yeah, right.
But so as part of his emptiness from that loss, he seeks out companionship. And this companionship, I think, is found in his gaze into this pool of water, and he sees his reflection.
Yeah.
And this is very satisfying to him. Now, if I understand it correctly, the Greeks and particularly the Romans found this to be a particularly troubling attribute because it really inspired people to be somewhat disagreeable, okay, in a society that was really grounded in more closer relationships. Okay, now, this concept has also been picked up and made extraordinarily popular in the Freudian literature.
Absolutely. So Freud brought it into psychology.
Right.
And the whole psychodynamic field of psychology, where narcissism became a very negative thing describing behavior that was very self-involved, looking at oneself as the ideal, and became in some ways reflective of some ideals that would be kind of unpopular today. But then it grew from there.
Do you think that he implied that the narcissist, this is Freud now, was looking for himself, him or herself in other relationships?
He implied that the narcissist was looking for someone like himself in another relationship.
Yeah. We don't want to make this a Freudian seminar of some sort.
No.
But it's just a little background that this is not a new idea, that it's been kicking around for a long time.
Yeah. Kicking around for more than a century in the Common Era and for thousands of years in the Greek mythology era.
Right. So that says that people have been well aware of this personality trait.
Yes.
Now, I like your term here that we can make this very academic and talk about traits versus disorder. But you're basically saying that a trait, in this case, is one where these people may be most readily described as a jerk or just someone who's just not agreeable, difficult,
very self-centered,
demanding.
It's always all about you. It's always all about you. Yes.
That's somebody who lives with them saying that to them.
Right.
It's about you, demanding irritability.
Yes.
Now, if someone is in an effort to succeed in this world, which we all are at some level, no matter how much we want to admit it or not, no one wants to fail. People want to succeed.
Yes.
Right?
Of course.
They want to do well. And we see both in political and business figures, profiles that are dominant in the media. People have commented, I don't want to name names, but we all know who I'm talking about, that these people are narcissists.
Right.
Okay.
I don't know how it's possible to become a politician that is successful and not have some narcissistic traits.
Right.
Yeah, I mean, you have to be you have to be pretty grandiose to think that you, above anybody else around, is able to do that job. Yeah, it just smacks of narcissism. And I don't care whether we're talking about Republicans or Democrats, or we're talking about local or state or federal. I think it's true of everybody.
There has to be a certain degree of something beyond confidence. Self-confidence is a positive.
Self-confidence is very positive.
However, grandiosity is not a positive.
Grandiosity is, I'm better than you.
Yes.
And everybody else.
Now, in business, and I don't want to sound trite here, but maybe success in business is not to be agreeable. I'm using agreeability factor as
like
a
the opposite?
counterpoint, as the opposite of narcissist.
Okay.
Narcissists can be very demanding, can be the type that, what is wrong with you? How can you make such a stupid mistake?
Right.
Direct, blunt, demeaning.
Yes.
And certainly willing to push others aside to get what they want.
Yes.
Or to step on others, use them as a stepping stone.
Absolutely. That's why some people are successful at business and other people aren't.
Right. Now, I don't want to be the one who proposes that if you want to make it, you have to take on these traits. Okay. I think there is a place for a certain level of agreeable behavior. However, we see over and over again, the top dogs are often displaying narcissistic traits at the very least, if not ultimately having a disorder of narcissist personality disorder. All right, so we've come to some agreeing here. We're agreeable, and that is that open, helpful people often have less income. I mean, this is what is that.
That's what the research says.
Is that what okay?
Yeah, that's what the research
And
says.
why is the narcissist doing better with income? Because they're playing hardball. They're putting their needs first.
Right. Well, and I think probably it would be safe to say that the person with narcissistic traits who is successful in business does not have narcissistic personality disorder.
Mhm.
Because the personality disorder requires it to interfere with their ability to succeed in a variety of domains, including their personal lives, their occupational lives, their social lives. And so the disorder would preclude success, but absolutely people with high success in a very competitive field, such as business, probably has some pretty strong narcissistic traits.
Mhm.
Okay? They just don't have the disorder.
Right. One of the traits, one of the traits that people often display is a lack of empathy.
Yes.
You know, they
And
might
so if the person I'm competing with in the business world, I know if his business goes under, his entire family will be decimated. They'll be like in the soup lines. They won't be able to make it. But I want to succeed, and so I'm going to go ahead and push to succeed so his business goes under.
right.
I certainly have no empathy for my
Right.
competitor.
But you know, I don't want to put this strictly at the feet of the individual. I don't want to reduce this to the individual per se. This is
Okay.
also a larger cultural value.
Yes, it is.
We are not training people in the forums in which they're trained as young people in the skills of empathy. I don't think we are.
Oh, I don't think we are
Systematically.
either. Yeah, I don't think we
Okay.
are either. Right?
Okay. So when does, now we're going to get into some of this. When does this self-confidence trip over into narcissism? Now, you're saying that the narcissist in business, the person with the traits, the hardball player,
Uh-huh.
he or she would not be succeeding because they're not, the word I'm looking for here is, they're not a narcissist in the sense of having the disorder. People with the disorder, it interferes
It
with their
interferes.
life
Right.
abilities,
Right.
right? And people without the disorder
They tend to flourish.
they tend to flourish.
Right.
So, but when does self-confidence trip over into narcissism? What is this disorder you and I keep on referring to that we
Okay.
can help make them more aware of the difference?
Well, let's talk about the disorder.
Okay.
Okay. First of all, it's a personality disorder, which implicitly requires it to be a pervasive way of viewing the world across multiple domains. It's not just in their relationship world. It's not just in their occupational world. It's across all domains of their life. And it's present to a significant degree, and it interferes with occupational functioning, with social functioning in personal relationships.
So let me interrupt you here.
Yes.
So you're saying, because a lot of times this comes up in interpersonal relationships, a lot of relationships end, and they end, you used the term before, with one person saying to the other, I'm terminating this relationship. I'm getting out because it's all about you.
Right.
This whole relationship's been about you. And I can't be in a relationship like that. Okay,
Right.
so
Yeah.
that's what they say. It's all about you.
Right.
But you're saying that if a person is experiencing this in a relationship with the other that they've identified as a narcissist, but if that person is agreeable in other settings, then it's not necessarily true that they're a narcissistic personality disordered individual.
Exactly.
Okay.
Exactly. Yeah, it's got to be.
Right.
It's got to be in multiple settings.
Right.
Yeah, I mean,
See,
the person.
this is a very important idea because a lot of people want to say, hey, this person is a narcissist, meaning they're sick with this disease.
Right. Right.
And you're saying, be very careful. That if
Be
you're going to
careful.
say it,
Right.
make sure you've seen it elsewhere.
And
And it's
for it
pervasive.
to be the disorder. Yes, for it to be the disorder.
Okay, so you're talking about a pattern
Yes.
that
It's
is
a pattern of behavior that's been in place probably since the late teenage years. Okay. And it's pervasive across all domains or most domains.
okay. So family interaction, love relationships,
Right.
business relationships, general social relationships.
Yes.
Just to reinforce this idea, has to be across all of these different domains in their
Yeah.
life.
Yes.
Okay. So
Yeah.
what are some of the key patterns that are in the disorder? What are we looking at?
You talked earlier about a healthy sense of self-esteem. In a narcissistic personality disorder, the person has an unhealthy, grandiose sense of self and a grandiose sense of their abilities and a grandiose sense of their accomplishments and way beyond what is actual reality. Years ago, I had a client whose husband had narcissistic personality disorder. He also had bipolar disorder. So the two of them together were quite an intersection. And he was so upset. This was in the early 1990s when Desert Storm was brand new under Bush 1. And her husband was calling her and anxious and angry that he couldn't get through to the Kuwaiti embassy because he had an idea that was a great business proposition, and he had to work with the Kuwaitis on this, and nobody from the embassy would return his call, and never seemed to think that maybe they're in the middle of a war. They've got other things they need to be worried about. So his idea that was so important, he couldn't understand why somebody wasn't picking up the phone to talk to him. Okay, that level of grandiosity. Okay. Another symptom is a preoccupation with unlimited success, unlimited power, unlimited ability to do these things, and that just being preoccupied with these ideas. So you kind of get the idea with where this is going, that anybody else is less than and should be subservient to him or her, that women can do this too, although it is mostly men, requires excessive entitlement excessive adulation, wants people to be seeing and responding and bowing down, incredible sense of entitlement. I think it goes on and on. So these are some of the specific symptoms that we see in this. But I think the key point is that it's beyond what one would normally expect. I mean, if you've just produced a major motion picture film and it's opening night, it's reasonable to expect the media are going to want an interview with you. Okay. And they're going to be cameras flashing off, and that you're going to be walking down the red carpet. If you were an extra in said movie, had like a 2-second spot in the film without any credit or whatever, nobody's going to invite you to walk down the red carpet. It would be unrealistic to think that you should get such an invitation, let alone an interview. And if you're expecting that, that's a problem.
All right. So you mentioned earlier an important point, and that point is that ultimately the disorder gets in the way of functioning.
Yes.
Now, this is true in many definitions of a disorder. In the end, in mental health, what people look for is to what extent are these patterns of behavior dysfunctional, meaning they're messing up your life.
Messing up your life. Absolutely.
In a big way, not in some episodic way.
In a big way.
In a consistent, persistent way.
And so I think that people use the term narcissist referring more to traits than they do to the disorder, because as we know, the disorder requires a person to be really having a hard time. His life is severely messed up. And people with traits, frankly, are often just being jerks. Frankly, people who have narcissistic traits are being jerks, and they're probably making the people around them pretty miserable. So it's much more likely that the spouse of a narcissistic trait person, or friends or siblings or whatever, would be the one seeking therapy because they're so annoyed with this person who's messing up their life. He's messing up their life because of his behavior, but his own life might be just ducky.
Now, some psychologists believe, and I think their belief is well grounded, that if you scratch the surface of this grandiosity, you're going to get an emptiness, a profound insecurity.
Oh, absolutely. Absolutely. For the person with a narcissistic personality disorder, yeah, it's grounded in some developmental failure or something that happened to a young person developmentally, ages 3 or 4, which is, pretty narcissistic time in one's life. I mean, what's the classic 3-year-old? Me do, leave me alone, let me do it. No. Yeah, so, it's a pretty narcissistic time, and something happened. Not necessarily traumatic, but it was enough of something that the person kind of got stalled out there in terms of their personality structures, ongoing development. A lot of the bravado, a lot of this "I'm so wonderful" is an attempt to convince themselves that they really are. Because underneath it all, they're pretty empty, and they have pretty low self-esteem. Yeah.
Would you say that a coexisting phenomenon for them or problem would be depression?
Could be. Could be. I think they're doing a lot of warding off of depression, trying to make that go away. And if they were to get into treatment and begin to break it down, they probably would fall into a pretty severe depression. And not to say that wouldn't be a good thing, because then they could actually work on what the real problem is and maybe overcome the narcissistic personality disorder. But they don't tend to be the people who show up for treatment.
Right. So let's summarize for people, because we've been doing a lot of talking and giving examples. Fundamentally, what you've been saying is that the disorder is pervasive in all schemes of life.
Pretty much, yes.
It eventually leads to a dysfunction in life, meaning that they're not doing well in their job. They're not doing well in their relationship. They're not socially successful.
Yeah.
Okay, things are starting to fail.
Yes. If you have a person who always knows the best way to do things, always knows what's right, always can figure out what's best for everybody else, but is repeatedly fired from his or her job and can't maintain a job for a significant length of time at all, can't maintain relationships for significant times, that's probably a person with a narcissistic personality disorder.
So this might be the person who marches into the supervisor's office or the CEO's office, makes an appointment.
Yeah.
And without real good evidence says, by the way, you're destroying this whole business. Let me tell you what you need to do.
Yes.
Okay. But they don't really have anything specific that would be.
That's right. No real good suggestions to offer. Exactly.
Right. But they have a big idea. I think you should turn in a whole new direction. Move this company away from making widgets to making automobiles. Just move it away.
Yeah.
And they might soon find themselves unemployed.
Yes.
Yeah. Because not only would it be antagonistic because of their presentation, which would be, what is wrong with you? They would imply in their presentation to the CEO, what is wrong with you? How can you be so dumb that you can't see?
That you don't see this.
You don't see this.
Yeah. Now, the person who's being called a narcissist in the more casual way, as opposed to narcissistic personality disorder, could also have some of those issues, but you wouldn't expect it to be interfering with their employment. They may think these things, they may go home and express these things, but they've got enough sense not to go to the CEO and be expressing them in that setting. Like I said, they could be a real jerk, but still have a little bit more common sense.
Yeah. And again, that's why this is such a hard thing to tease out.
Yeah, it
And I
is.
want to remind people that clinically, a clinician really needs about 6 months to a year with a client to be certain that the overall pattern is in place and that the dysfunction is persistent, and that and then they can say the person has a disorder.
Yes.
This is an important principle for people who want to separate this out in their mind. Now, I'm not saying that now that you hear that a person underneath is insecure and that's why they're acting like this, that you should be somehow warm and fuzzy toward them. Okay.
No,
I don't want to go that far.
No.
I mean, you're allowed to be angry and put off.
Right.
But on the other hand, in your more generous spirit, you might understand that you're really dealing with someone who's potentially
Who's sick. Somebody who's sick.
Yeah. All right. So I think we did a pretty good job here talking about narcissism. I don't think it's going away anytime soon in our society.
No. I think it's safe to say that everybody who has been at least somewhat successful in life has had to have some moments where they were behaving like a narcissist. Okay, where they turned off the empathy bead, where they stayed very self-focused on what they needed, where they put their own needs first and they put the needs of their family second or even last. And I guess the difference between somebody who is a narcissist in general, not personality disorder, but a narcissist kind of in general, and other people who aren't but are successful is that you can be this way selectively. You can decide, this is really important. I've really got to do this. I had a time in the very recent past when I knew I had to get some CEUs done. I'm running out of time. I have a bunch I've got to do. And I just turned off the needs of the family. And I hunkered down and I put the thing on my head and I did it to get some CEUs completed. Not that I didn't care about my family. I certainly did.
CEUs.
But I knew I had to get, continuing education units, timelines, and all that kind of stuff. It's something that had to happen. And it was a kind of a lull in what was going on. And I just decided, okay, people are going to have to lull without me for a while. I'm going to do this.
Okay.
And spend 3 hours to get this chopped off. And I've got more coming up. But it was a moment of me being self-important for my own needs. And so, yes, we all have to do that from time to time. That's part of what you have to do to be successful. But people who are not narcissists in general will not do that all the time. It's not the way they are in every relationship and in every moment. But you can be like this all the time and still not have the personality disorder, but you are a jerk.
Okay. So one last question, then we'll move on in light of time to the topic of trauma, because that's another term that's out there.
Gets thrown around a lot.
My last question is about the narcissist, is with the disorder. How likely do you think that person would be to enter into therapy?
Very unlikely.
Okay.
Very unlikely. The most likely way a person with narcissistic personality disorder would enter into therapy would be if something happened in their life that opened up that depression. And they might enter therapy because of the depression, and then as they're working on the depression, it becomes clear that narcissistic personality disorder has been the way they've been working through life. That could then get worked on. But without the depression, no.
Okay.
No.
All right. Now to put on a different hat, and we'll talk about trauma. Trauma. Now, one thing I want to say about you that I know from your professional biography is that you have studied trauma beyond the doctoral level,
Yes.
specifically,
Yes.
long before it was a popular field of study.
Long before it was
And
trendy. Yes.
I think you said to me off screen that you had attended seminars years ago and are a founding member of the trauma division in the American Psychological Association.
I am. I mean,
Yes.
I'm one of the signatories that
Uh,
actually got it accepted by APA to have its own division.
All right.
Yes.
So that's going to mean to me that you've been around this topic and almost from the very beginning.
I wouldn't go that far, but I've been
Right.
around I've been around since 1990 when a fellow professional in the community who is no longer practicing and he's no longer in the community, but at that time he was considered the leading expert in our area in a topic then known as multiple personality disorder. And he had a client who did not live in my county, did not live in the county where I was working, but needed to go into community mental health rather than private practice because of her funding issues. And he actually called the health officer of his county to get permission from his county to the county where I was working to have this client seen in the county where I was working so she could see me. I was back when it was all catchment areas and that kind of stuff. This was way back in the day. Because he said he knew that I was a good therapist and he knew that if I began working with her, I would get the training. And I did. And so she and I talked on the phone and agreed we would be willing to give it a try. And I immediately signed up for a conference that was meeting like in a month that I could go to that would help get me up to speed. And then one thing led to another and led to another and led to another. And after multiple years, I guess it was 10, 11, 12 years after that I actually did an intensive training with the person who would have been considered the international expert on what we now call DID, dissociative identity disorder. That's the new name for multiple personality disorder. Not so new any longer. And I did a one morning a month for 9 months seminar with this individual who was spectacular.
Okay.
Many, many years of conferences and individual training and more stuff. Yeah.
Okay, so let's go to trauma.
Let's go
Now,
to trauma.
And again, the biography speaks for itself, so you're legions ahead of my knowledge base on this topic. But I will try to ask you some questions so that our audience can get a better idea. Now, a lot of people believe that, and the media hasn't done us any good, that they have an experience and immediately has led to post-traumatic stress disorder, which is probably the most commonly understood trauma-based phenomenon.
Disorder. Yeah.
Right.
Okay.
Now, one thing I do remember from my reading, again, years ago, was the epidemiological studies about 9/11, the problems associated afterward for people psychiatrically. And I was astounded, actually, by the data. And the data suggested of all of the people involved in that, first responders, people in the building, people watching other people, and all of this at every level, as well as those trying to help, that of all of these people, after 1 year, 6% thereabouts actually came to have the disorder.
6 months later. Yeah.
6 months, a year later. That's when they did the study.
Right.
6%. I would think an event like that, the numbers would be higher.
And 6% is about the number of people in general in the society that have post-traumatic stress.
So what I'm getting at here is if someone is on a highway and they turn their head at an inopportune time and they see an accident, and unfortunately they see the circumstances around that, and they go home and they're very upset by this, and they might declare that they have now post-traumatic stress disorder, that They have had a nightmare about this. They can't get the image out of their head, etc. Would you educate them about how their thinking might be a little off on that?
Their thinking is premature.
Mm-hmm. Okay.
There is something we call acute stress disorder, which can happen like immediately after you've been exposed to some traumatic incident. So you see a dead body, whatever, that can last for a few weeks, but it doesn't become post-traumatic stress disorder for a month. And for most people, it resolves by then. For many people, they're diagnosed at a month and it's gone by 6 months. So it's hard to know. Everybody's different. It also has to do with what experiences people might have had before that time. Is this incident reminding them of something else? And so it's kind of like a trauma being layered on top of a trauma. That would be different from somebody who has never seen anything like this and you don't know anybody who's involved in it. And yes, it's upsetting, but the upset fades away over time. I think it's important to recognize that, well, let me give you some statistics. Let me give you an example of an epidemiological study that was done. And this was done in the very early 1990s. I don't remember exactly when. And it was a massive study, hundreds of thousands of people over all of North America. Every demographic, every geographical area, there was just everybody. And the study involved a follow-up on emergency room discharges. And they followed up all of these people. It was an impressive number of phone calls they made and asked a lot of different questions. But at root, there were just a couple of questions they were really interested in. And one was a history of childhood trauma, and it was more closely defined than that. So significant adverse childhood experiences. And the other was the incidence of attendance in outpatient mental health treatment, inpatient mental health treatment, or incarceration. And when they crunched all the numbers, they found that 90% of people who had received outpatient mental health services in a clinic setting had had significant adverse childhood experiences. 95% of people who had had an inpatient psychiatric hospitalization had had significant adverse childhood experiences. And 99% of people who had been incarcerated had had significant adverse childhood experiences. And so it's really important to recognize the role of significant adverse childhood experiences, which translations childhood trauma, and what it does to adult experiencing, but also to recognize that it's pervasive and that sometimes children don't even remember that they had these childhood adverse experiences, and then they're going down the highway and they see something out the window and suddenly they are flashing back or whatever. Okay, so it's hard. I wouldn't say, no, that wasn't traumatic, because for you, it might have been. I don't know. I would say that we use the term trauma kind of incautiously, and it referred to all kinds of generalized things. I was traumatized because I had an argument with my sister on the phone. Probably not. Okay, maybe. Depends on what your childhood experiences were like, but probably not. But okay, whatever. So in the trauma field, we tend to talk about capital T traumas and small t traumas. And a capital T trauma is a trauma that just about everybody would recognize as traumatic. Being in a car accident where you are injured is certainly a capital T trauma. There are certain medical traumas that would be a capital T trauma. Being raped, for heaven's sake, is a capital T trauma. Childhood incest is a capital T trauma. Being beaten to within an inch of your life is a capital T trauma. Having a parent smack you on your padded behind one swat because you were having a temper tantrum might have been upsetting, might have even been a lowercase t trauma, but would not be considered an adverse childhood event. So we have to kind of look at all of these, and it kind of concerns me to have the term trauma or having been traumatized kind of bandied about in the vernacular. I think it's too easily spoken about. Bad stuff happens, and it's not always traumatic. Trauma happens, and it doesn't always get talked about. So I think not every bad thing is a trauma. That doesn't mean it's not bad and that it wasn't upsetting, but it may not necessarily be a trauma.
Mm.
Okay.
Yeah. I mean, I think what you're saying is that, one, this is a word that's been overused and has lost much of its meaning.
It's lost a lot of its meaning. Yes, it really has.
And second, that it has become a knee-jerk reaction to say that a negative experience was somewhat traumatizing.
Yeah. Well, yes. I mean, and again, it kind of depends on the person. And an example that I use with clients is that, if somebody reaches out, let me put my arm up here. If somebody reaches out and puts their hand on your arm like that, does it hurt? No. Can you feel it? Yeah, my fingers are really cold right now. I can really feel that on my arm. Okay. But does it hurt? No. Same arm, third-degree burns, fresh third-degree burns. Somebody puts their hand on my arm. It's stingingly, excruciatingly painful. And having been traumatized, significantly traumatized, can lead one to feel emotionally like you've got third-degree burns. And anything that comes close to that can be very painful, even though anybody else looking at that would think you're a little weird. It really shouldn't be. It shouldn't really hurt like that. Just my fingers on your arm. What are you doing? Shouldn't be that. But you don't see the third-degree burns. Okay. And so to recognize that having those third-degree burns can make you exquisitely sensitive to things that other people wouldn't see as painful at all. I hope my clients can appreciate a little bit more that their experience is valid. And I think the other thing is that I would want to explain to the people that they live with, their significant others, that maybe they need to be a little bit more sensitive about what my client is going through, because nobody would think about just putting a hand on the arm of somebody, but you wouldn't do that with somebody with third-degree burns. It's hard because in the trauma field, anything can be traumatic, but out in the general population, very little is really traumatic. That doesn't mean it isn't upsetting, but it's not really all that traumatic. But for somebody who's been traumatized and is still dealing with those third-degree burns, it can be excruciatingly upsetting. And so it's really difficult for me to say people are overgeneralizing that term. You shouldn't be doing that, because I don't know who those people are. And for them, it might not be overgeneralizing at all.
Well, this has been wonderful. We've reached our time, and I don't want to exhaust you with any more questions.
Thank you. I appreciate that.
And I think I'll have you back, and we'll continue this conversation.
Okay.
Covering two other areas of disorder that is often talked about, and let's use the word in the category of therapy misspeak. And that would be obsessive compulsive disorder. And the big one that we could spend some time with is bipolar disorder.
Oh, yeah.
So I think that those two alone would take up our time. But
I can imagine they would.
But we might also return again to other topics after those that would include talking about some of the other personality disorders that, again, are spoken of freely. And what's one that people throw about?
Borderline.
Borderline, yeah.
Yeah. Oh, she's borderline.
Well, how about sociopath? Do people
sociopath or antisocial?
Right. Okay. So we'll also try to squeeze those two in, or one of those.
At some point. Yeah. At some point.
Okay. So
yeah.
I'll see you next time.
Okay.
And thank you again for coming in. And as usual, you were terrific. And I hope we've given an excellent overview, particularly of narcissism and trauma. But narcissism, we spent a lot of time, including Greek studies.
Well, but it goes back that far.
No,
It's
I know it
important.
goes back
Yeah.
that far. Obviously, it's been a problem for a long time.
It's for a really long time.
Long time.
That's right. A lot of
Okay.
jokes. Yeah,
So-
a lot of jokes.
So with that, let's conclude,
Okay.
and I will see you soon enough. Thank you
Okay,
again. I
very good.
appreciate it.
You're welcome.
Thank you for listening to Shrink Wrapped Faith, and I hope you join me for our next episode.